Infants. Infancy is a time of excited physical and emotional growth. An infant is a young child from birth to 12 months who has not begun to walk or talk. It is a period of very rapid growth, and nutrient requirements per kilogram of body weight is the highest in the life cycle. Healthy eating habits form in early childhood. If parents and other caregivers practice good nutrition and are flexible, they can lead an infant into lifelong healthful food habits. A family environment that encourages healthy eating will provide the nutrients needed to optimize physical growth and development. Growth and development. Infancy is a time when undernutrition and overnutrition are likely to develop. Long-term health problems depend on the severity, timing, and duration of the nutritional insult. Infants are expected to double their birth weight by around 4 months of age and triple it by 12 months of age. After that, they grow slowly and steadily for 5 more years before fully doubling their weight again. Sometimes infants and young children do not meet expected standards of growth. Some of them may be due to failure to thrive, which is a general diagnosis with many possible causes. About 54% are due to parental neglect and abuse, 6% a medical condition, and about 40% some combination thereof. An anthropometric assessment is done to monitor the infant's growth on a regular basis. These measures include length, weight, and weight for length, as well as body mass index. Notice that for infants, we do not use the word height, we use the word length as they are measured lying down. We also measure head circumference. Nutritional needs. Breastfeed is the best source of nutrition for infants. The RDA for infants up to 6 months of age are based on breast milk, and those for infants 6 to 12 months of age are based on formula and solid foods. However, if the mother chooses not to breastfeed, she should use an iron-fortified infant formula. Formula should then be used for the first 12 months. No cow's milk should be given before age 1, and skim milk should not be given before age 2. And the skim milk part is primarily because they do need the extra calories and fats. Infant formulas are specially made to meet the nutritional needs of infants. Many women who breastfeed use formula to supplement their milk when they return to work or school, or if they are running an errand and want to get dad or other caregivers involved. The manufacturer's direction should always be followed for proper dilution of the formula. Infant formulas are specially made to meet the nutritional needs of infants. Many women who breastfeed use formula to supplement their milk when they return to school or work, or when they are running errands and want to get the father or other caregivers involved in the child care process. Please follow the manufacturer's direction for proper mixing and dilution of formula. This is something that we are very Infant formulas are specially made to meet the nutritional needs of infants. Many women who breastfeed use formula to supplement their milk. And it is important for us to tell the clients to follow the manufacturer's direction for proper mixing and dilution of formula. And extra care need to be taken when explaining childcare feeding with young moms. Formula-fed infants who develop vomiting, diarrhea, constipation, abdominal pain, or colic are frequently switched to soy-based formulas. Vegetarian parents also use soy-based formulas. In these formulas, soy is the source of protein. Soy formulas are lactose-free and iron-fortified. Energy. An infant's need is the amount of energy required for basal function, growth, and activity. An infant's energy need is the amount of energy required for basal functions, growth, and activity. Those needs are about twice that of an adult. And the amount of energy an infant needs for activity varies, increasing as the child becomes more mobile. In general, a newborn requires about 100 calories per kilogram of body weight. Protein. Protein needs during infancy are higher than at any other time in the life cycle. Protein needs during the first 6 months are nearly twice as high as the needs of an adult. Breast milk and infant formula provide complete protein with all the essential amino acids. Carbohydrates. Carbohydrates are major energy sources for infants, and this allows protein to be used primarily for growth and not as an energy source. Lactose is the main carbohydrate in breast milk and formulas made from cow's milk. Fat. Triglycerides are the major energy source in breast milk, providing about 50% to 55% of the calories. Fats in milk enhance a baby's sense of fullness between feedings, and infants should consume at least 30 grams of fat per day. Vitamins and minerals. Breast milk provides the right amounts of vitamins and minerals that babies need. Therefore, the vitamin and mineral composition of breast milk is the reference point for designing infant formulas. Breast milk is lower in a few nutrients, such as iron and vitamin D, but infants absorb these nutrients more efficiently from breast milk than from formula. Vitamin D is a key nutrient for absorbing calcium and mineralizing bone. Rickets is caused by inadequate intake of Vitamin D is a key nutrient for absorbing calcium and mineralizing bone. Rickets is caused by inadequate intake of vitamin D and insufficient exposure to sunlight in infants and children. And rickets is evidenced by bow-legged children. When you see a baby with bow leg, most of the time it's because of a vitamin D deficiency or rickets. Inadequate vitamin D levels are a concern for those who are exclusively breastfed, those not exposed to sunlight, and those with darkly pigmented skin. Vitamin K is necessary for the production of prothrombin, a substance needed for blood to clot. Although intestinal bacteria synthesize vitamin K, the gut is sterile at birth. Babies are born with minimal stores of vitamin K, So a shot of vitamin K is given at birth, and this is usually done right after birth in the hospital, a vitamin K shot. Both human milk and infant formula provide adequate vitamin K. Vitamin B12 is essential for cell division and normal folate metabolism. Mothers who include meat, fish, and dairy products in their diets produce milk that is adequate in vitamin B12. Breastfed infants of vegan mothers may need a vitamin B12 supplement. Infant formula has adequate amounts of B12. Breast milk is low in iron, but about 50% of it is absorbed compared with only 4% of the iron in formula. The infant's iron stores begin to diminish by about 4 months, and by 6 months, a breastfed infant needs an additional source of iron, which can be met with iron-fortified infant cereals. Formula-fed babies need iron supplementation from birth, but the iron is already built into the formula. Fluoride. Breast milk is low in fluoride, which is important for dental health. Breastfed infants need fluoride supplements after 6 months, depending on the fluoride content of the local water supply. If formula is mixed with fluoridated tap water, no supplementation is needed. Supplementation is needed if the local water is not fluoridated. And also if someone may be using well water, which may not have fluoride because fluoride is actually added to city water. Feeding solid foods, yummy. Many parents introduce solid foods a little bit too early. Feeding solids too early may lead to overfeeding and food allergies. Solid foods should be started at 4 to 5 months. And iron-fortified cereal is usually the first solid food that is introduced. Solid should be fed when infants can hold their heads up and when the protrusion reflex is gone. And the protrusion reflex is that baby has the tongue sticking out and not able to move the tongue to the back of the throat in order to swallow. Many parents put cereal or porridge in the bottle when infants are just a few weeks old, primarily to make them sleep through the night or just to fatten them up. We do not recommend putting cereal in the bottle for several reasons. Breast milk and formula are adequate to meet the nutritional needs. Infants need to eat every few hours, and most will sleep through the night by 4 to 5 months. Cereal and milk mixture can also aspirate in the lungs and may cause choking and possible infections in the lungs. So cereals are usually fed for 4 weeks before other foods are introduced. And we recommend one new food to be introduced every 5 to 7 days after that time. Introducing multiple foods does not allow for the easy detection of food allergies. When feeding solid foods to infants, infants should not be given added sugars, baby desserts, sweets and cookies, sodas such as Kool-Aid, sweet tea, salty foods, honey, because it can cause infant botulism, so no honey before age 1, fruit juice. Common nutritional concerns There are 8 common food allergens that account for 90% of all allergic reactions: milk, eggs, peanuts, tree nuts, fish, shellfish, soy, wheat. Now, food intolerances are very different from food allergies. Food intolerance does not involve the immune system and can be caused by a person's inability to digest certain substances such as lactose. So someone can be intolerant to lactose. And food intolerance can be pleasant, but it is really dangerous. Iron deficiency anemia. Infants are born with a good iron store, and iron-fortified cereals are usually started at 4 to 5 months, and meats are introduced a few months later, and these help to maintain iron stores. Between 9 months and 3 years of age, most anemia is the result of iron deficiency. And a lot of times when we notice iron deficiency in older infants and even toddlers, a lot of time it's due to actually drinking too much cow's milk. Overweight and obese. Infant body mass index fall into one of 4 categories: underweight with the BMI below the 5th percentile, normal weight with the BMI between the 5th and the 85th percentiles, at risk for overweight, BMI between the 85th and 95th percentile, and overweight, BMI at or above 95th percentile. Please note that we do not use the term obesity when we're talking about infants and young children, primarily because they are still growing. It's not because we are not concerned about their weight, but this is how pediatricians classify infant body weight. Overweight and obesity in infants, and we're using that term because that is what a lot of times people understand, are usually due to improper mixing of formula, which means that sometimes they don't add enough water, too concentrated. Feeding too much formula. Every time the baby cries, they give a bottle primarily to quiet or shush the baby. And also introducing table food too early and feeding too much table food, and also providing snacks, which are a no-no for infants. Underweight in infants that is not due to a medical condition is usually due to improper mixing of formula. In this particular case, adding too much water. And sometimes this happens with teen moms, young moms, or sometimes poor moms who add too much water thinking that they're going to stretch the formula to last a little bit longer, but that also means you're diluting the calories and the nutrients. Not giving enough formula and not giving enough table food when they are able to start getting table food. Baby bottle tooth decay. I think that this is one of the most devastating things that I've seen in my practice. Babies coming in with their baby tooth already pretty much rotten because of improper feeding. So baby bottle tooth decay, also known as nursing bottle mouth syndrome, starts in infancy but is usually manifested when the child is 18 months to 3 years of age. It occurs because of prolonged exposure of the milk, baby bottle tooth decay also known as nursing bottle mouth syndrome, starts in infancy but is usually manifested when the child is 18 months to 3 years of age. And it occurs because of prolonged exposure of the teeth to milk, juice, or other sugar sweetened liquids. Also, infants and young children should not be put to bed with a bottle, and this includes nap time. And nursing bottle tooth decay is probably one of the saddest things I have seen in my practice when a baby's baby teeth pretty much are decayed and rotten. And sometimes it's so severe that they have to be pulled and posts need to be put into the gums. Prolonged use of bottle. Young children should be weaned from the bottle by 18 months. Prolonged use of the bottle may cause cavities, poor teeth development, and ear infections. So begin to transition the baby to a cup. Breastfed babies can be transitioned to a cup without ever using a bottle. But as much as possible, by the first birthday, the baby should be using a cup more often than they're using a bottle. And by 18 months, we would like the baby to be completely weaned to a cup. They do have the manual dexterity and the skills to do so.